my name is Emma, and I am 15 years old, and I am a ninth grader at American High School in Fremont. And it is my pleasure to introduce Dr. Vanessa L. Kamari, a physician scientist at Stanford University, who has dedicated her work to celiac disease research. She has been looking into new ways to measure the intestinal damage and inflammation caused by celiac disease using a swallowable capsule that can sample the small intestine without need of endoscopic procedures. Today, she will share how this technology is opening new doors for celiac disease research and what it could mean for patients like you. Please join me in welcoming Dr. El Kamari.
Thank you so much, Emma. Hi, everyone. I am very excited to be here. So my name is Vanessa Alkamari. I am an infectious disease doctor. You would ask yourself probably, why is an infectious disease doctor doing here? Because of an interest in understanding how initially different viruses and bacteria could affect our gut immunity, I got involved with celiac disease about 3 years ago. And I fell in love, really. It's such a wonderful community. And I have since dedicated my research to it. And I really hope to dedicate the rest of my career to it. Wonderful community, the best of the. So not gonna go over all of this. I'm sure you guys already know, like, what are the biggest challenges that we still face. And a lot of it have already been like Dr. Javari and Dr. Fernandez Becker have like already touched about, is like really like some of the struggles in being able to non-invasively monitor celiac disease. The small intestine is really a place is where the disease happen. And one of the biggest issues, and it's one of the most important organs in our body. But at the same time, it's one of the hardest organs to reach. It's really where all of the nutrient absorption happen. About 70% of our immune system lies there. And we really have no idea of the microbes and the microbiome that are there. Usually, whenever we want to study that, we will rely on stool samples. And as you can all remember from your biology classes, I'm sure, the stool is really very far from the small intestine. So whatever you're getting from the stool is really very different from the environment that you see in your small intestine. And kind of like we said here, currently the only things that are available to access the small intestine is endoscopy, which I'm sure is not a lot of fun for a lot of you guys know here, and then blood, which is not a best way to predict what's happening inside of the gut. So this is why we have been collaborating with a biotech. And together we have been developing this wonderful device called the CapScan device. And what it does is that it allows us to sample some of the small intestine in a non-invasive way. So this is the capsule the device that you actually, okay. So this is the capsule that you actually take. It's the size of a vitamin pill. And inside of this capsule, there's a small tube that is usually just embedded in it. And the way that it works is that the capsule is designed in a way that whenever it reaches a certain pH, the membrane of the capsule would just disintegrate. And inside, the tip of the capsule will show up. And as it's traveling through the GI tract, it will keep opening and it will start sampling some of your intestinal lumen fluid. So basically, you just swallow it, it's a pill, and based on the pH, it's designed in a way it will just disintegrate and then start sampling, and eventually you just catch it in your stool, such as a tube. And I usually always carry it with me. I forgot today, but it's really the size of a pill. And then the tube is a very flexible, not without any it doesn't have any electronics or anything. It's really a hollow tube. It's just made of a one-way valve that allows the fluid to just go and fill the whole tube as it's traveling. So we end up having, this is a real sample that came out, and this is how it would look like. So you would have different segments. They're not segments. It's a one tube, but since it's just like a one-way valve, what you end up having is like different fluids from along your GI tract. And we can clearly know that those are from different parts of the intestine. And what we end up doing is that we cut up this tube. We usually get about 600 microliter of fluid inside. And with all of the technology today, that is enough to give us a lot of information. So we will cut it up and we will put it in small tube that will go for testing. So what do we measure? A lot of things. Among them, I'm not going to go into all the details, but we're able to measure basically all of get the DNA test of all of the microbes that live there, about the millions and millions of microbes that live there. We're able to measure a lot of the enzymes that exist there, which can try to help us differentiate whether there are some patients who have some enzymes that other people don't have. We're able to measure some of the cytokine, which is basically like the surrogate for inflammation that is there. So in other words, we're able to directly have a readout on what is happening in the small intestine, the site where celiac disease is. So the study we are undergoing, you guys have met most of the team. You're aware about most of the team here. I couldn't have done this without the great collaboration of our physicians here. Inflame study is the name of our study. We are recruiting adolescents 14 years and older. We're also recruiting adults. This is the age that we think the capsule so far has been safe for, but we hope that there's a different design of the capsule that is smaller that we think that will come up and could help with smaller kids. And the people we're recruiting are patients or participants that are newly diagnosed or with celiac disease, or the one who are on untreated celiac disease, who have been taking gluten and are about to start a gluten-free diet. And what we do is basically they take the capsule along a year. It's up to them. It depends really on each participant, how much they want to get involved, how much they have time to get involved. But we basically, the goal is to be able to monitor how they do over time, up to 1 year after starting their gluten-free diet. And at the same time, to understand what a healthy gut looks like, we have other healthy controls that we're also recruiting. And in the past, I want to say month or so, we have added a new group of patients that we have been looking at. And those are participants who have been with celiac, who have been on gluten-free diet for the past year, but still have some symptoms. And as you can imagine, the goal is really to try and understand why some of those patients, despite gluten, are still having symptoms, and trying to get a better sense of their intestine milieu. We are short on time, but basically, if anyone is interested in participating, it really depends if you're an adult or a kid. For adults, kids, adolescents at this time. It's pretty straightforward. We send the kit at home, and everything can be done at home. If you are between 14 and 18, it requires to have one clinic visit, pretty easy. It takes about 45 minutes. And what we do is you'll just swallow the pill. We'll take some blood. We take some saliva, and pretty much it. Ask you some questions, and then we'll ask you to just collect those, the capsule and at home, and then send it back to us. We use a pretty cool device for the blood, which is amazing. We should all be doing this. It's called the Tasso kit. This is a very non-invasive way to get blood. No needles, nothing like that. We just put it here, and doesn't hurt, and just gives you blood. So far we have had in our study alone, about 60 capsules from celiac patients have been taken. Across different studies, this is happening in different disease too. We have about a couple of hundreds of patients have taken this capsule. So far, we've had no complication. It works great. We have, from our preliminary studies, we've been able to see that it really is very sensitive to show us things that we can see in blood. And then we have been also working and collaborating with different departments at Stanford, where we have been able to develop some probes that have been able to show us very sensitive way how we can track inflammation over time. Obviously, there's a lot we can do, and we hope to do with that. Really, the big goal would be eventually to find this is just a different approach, a different way to that could help us clinically, but also could help our patients every day in monitoring their disease. But at the same time, also give us a lot of insight about some of the mechanism of celiac disease that we still don't know, including how is the different environment affecting, and why are some people with celiac still have some symptoms? How are the microbe affecting that, among a lot of others? So please let us know if you are interested in any way to get involved. And thank you for everyone who have made this possible, especially our participants who have been wonderful so far, and all of their families. Thank you so much.